students, welcome back. Now we are going to see the structures related to the mediastinal surface of the left lung. So we have seen the right lung. Now we are going to see this left lung. Okay, this left lung. So if you want to see this left lung mediastinal surface, we have to rotate this left lung towards the lateral side so that the mediastinal surface come to anterior aspect. So now we are seeing the thing here for the left lung. Okay, left lung mediastinal surface. So simple thing is, so this cardiac notch, when we rotate this, so this cardiac notch will be present this side, and the posterior border of this mediastinal surface will come on this side. Okay, now say this thing. So this is the left lung. So how can you identify the left lung? It is having a notch on the anterior border, that is the cardiac notch. Okay, now what are the structures related to this left side of the lung? So now we are going to see. So already you people know that this is the hilum at the root of the lung, which is present almost at the center. And so anteriorly, so this part is related to the left ventricle. Okay, and then above this left ventricle, so here you'll have the pulmonary trunk. Over this pulmonary trunk you'll have the arch of aorta. So arch of aorta gives branches, isn't it? So that too, this is on the left side. So the branches are left subclavian artery and left common carotid artery. So what are the things? Subclavian artery and left common carotid artery are the two arteries which are coming from the arch of the aorta. Okay, so one is left common carotid and this one is the left subclavian artery. So these two arteries are also related on the left side of the lung mediastinal surface. After that, so it is related to the left recurrent laryngeal nerve, left recurrent laryngeal nerve. So on the right side, we have seen at this right side, it is related to the right vagus nerve. Here it is related to the left recurrent laryngeal nerve. Okay, and in between these two branches of arch of aorta, so here another nerve is passing in between them, that is the left phrenic nerve. And also in the same way, which is another nerve which is coming at that part is left vagus nerve, is also coming at that side. Okay, so these are the relations on the left side anterior aspect of the mediastinal surfaces. And after this left laryngeal nerve, so this is left laryngeal nerve is present on the left side of the trachea. So here we can see the left side of the trachea. And then this one is the esophagus. The entire red one is esophagus. In the middle, you will have a duct-like structure called as thoracic duct is related on the left side. Okay, so these are the structures which are related to the left lung. So again we will see what are those things. Yes, So this one is the left ventricle. Over this, it is having pulmonary trunk, and over this pulmonary trunk you'll have the arch of aorta. This arch of aorta gives branches to left subclavian artery and the left common carotid artery. So these two branches are related. In between these two branches, one nerve is coming down in front of the root of the lung or hilum. So that nerve is called as left phrenic nerve, and also in the same route which is passing from anterior to the posterior. So this one is the left vagus nerve, and also on by the side of the trachea it is having left recurrent laryngeal nerve, and then it is having a trachea, and then behind this trachea you'll have the esophagus. Over this esophagus a duct is present that is called as thoracic duct. So these are the structures are related to the mediastinal surfaces of the left lung. Now coming to the root of the left lung, and I have explained what do you mean by this root in the right lung. So the same thing also you have to define on the left side. So now coming to the structures which are passing through this hilum are, so it is having pulmonary artery, it is having pulmonary artery, and also one bronchus, so principal bronchus. So in the right lung we are having two bronchus, one is the eparterial and hyparterial, but in the left lung only one principal bronchus is present. So that is the main difference between the right and left root of lungs. So whereas in the right it is having two bronchus, one is the eparterial bronchus and hyparterial bronchus, but in the left side it is having only one principal bronchus, and it is having anteriorly it is having superior pulmonary vein, and inferiorly it is having inferior pulmonary vein. Okay, and the structures which are present on the left side from above downwards are in the root. One is the pulmonary artery, and then the bronchus, and then the inferior pulmonary vein. So above downwards like this, and then anteriorly superior pulmonary vein is present. So these are the structures which are passing through the left lung. So if anybody asks what are the relations to the root of the lung, you have to mention above what are the structures passing above the root of the hilum. You have to mention all these structures related to this. Anteriorly, what are the structures related to the root of the hilum? Posteriorly, what are the structures related to the root of the hilum? You have to mention it. Okay, and another important thing is it is also having some pulmonary flexes on the anterior aspect as well as the posterior aspect. These two pulmonary plexus are also related on both right lung as well as the left lung. So inferiorly it is having pulmonary ligament. So these are all about the structures which are related to the mediastinal surface of the left lung. Thank you.